Lung cancer is quite common. Anyone can get it, and that's an important thing to know. Of course, smoking is a risk factor for lung cancer, so we do see it in people who smoke or who have smoked, but there are many people who have never smoked that get lung cancer. As many as 15 to 20% of the patients with lung cancer are those patients. We worry here in Connecticut about radon gas. That could be a risk factor. Asbestos, which is in some of our homes, and that can, in the long term, cause lung cancer. Of course, smoking, as I already mentioned. And then there are many factors that we're still figuring out. There probably are some genetic factors. But right now, everyone has to keep an eye out for this disease, and we treat people from all over the country. Lung cancer presents in so many ways, but oftentimes it could just be as simple as a cough, something that looks like a flu or a pneumonia, but that doesn't go away. It's treated and it persists. Of course, in the most advanced stages, lung cancer can, go to other parts of the body and people can become weak or fatigued or have pain. But quite honestly, the most common presentation is usually asymptomatic. Someone is going for a hernia procedure and they're getting an X-ray, and the X-ray shows something that doesn't look quite right. Or I had a patient recently who tripped and fell and ended up in the emergency room for an orthopedic issue, and the X-ray showed that there was something in the lung. So it can affect anyone, and it's just something that internists and pulmonologists, the people that see the patients first, need to think about. And if you have something in the lung that shouldn't be there, you have to observe it and follow it. We do a lot of that here at Yale Smilow Cancer Hospital. I can tell you that right now, especially the type of work we do here at Yale Smilow Cancer Hospital, we personalize the treatment. So if someone comes with lung cancer, what we've learned is every lung cancer is different. I would say it's lung cancers. So we would actually look at the tumor, the abnormal growth, and we would look at all the different genes and decide what's causing that cancer to grow. And in some of the people who have never smoked, there are very specific targets that we have, or in some cases we have pills that can target lung cancer and cause it to stop growing. For those with more advanced disease, we have immunotherapy. We can target the immune system to work against the cancer. Some of those therapies were developed here at Yale in the last decade by Mario Snow, Scott Gettinger, Harriet Kluger, and others. So there are many new advances in this disease. And then one of the biggest advances is multimodality care. So if you get lung cancer, it's important, in my opinion, that you be seen by a group where you have a surgeon, a radiation oncologist, a medical oncologist, social worker, support care. You don't know going in who's going to be needed to fight that disease, but it's important to swarm on that cancer and attack it from all angles, the types of things we do here. And screening has been shown to improve survival in lung cancer. Now remember, you're screening someone who doesn't have lung cancer, but usually it's someone who's over age 55 with over 30 what we call pack years of smoking, meaning you've smoked for 30 years, 1 pack a day, or 15 years, 2 packs a day. And right now, if you haven't smoked for 15 years, you're not considered a candidate. I actually think we should broaden the guidelines. But at least the first definition I gave, that's covered now by insurance. So people can come in, they can come here to the Smilow Lung Cancer Screening Clinic. We're actually starting to do screening at all of our care centers. So the 15 care centers around Connecticut, and now one in Westerly, Rhode Island, they are all doing screening as well, or they're beginning to. I think screening is very important. People should talk with their internist, whoever they see on a yearly basis, about whether they fall into that risk factor. The best way to treat lung cancer, one, is to never get it. And as I mentioned, you can't avoid it sometimes because there are many people who get it despite not having any of the risk factors. But then once you get it, finding it early and taking care of it early, and then determining if anything more needs to be done.